This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Diabetes can lead to some pretty severe complications, but perhaps the most terrifying is blindness. With continual exposure to high blood sugars, tiny blood vessels in the eye can leak, causing vision loss. It's called diabetic retinopathy. The good news is it can be prevented.
Okay.
Dr. Catherine Smoot of Chesapeake Eye Center covers a lot during a typical eye exam. And if you have diabetes, she takes her thoroughness a step further.
We always ask them if they've had any history of diabetes, but more importantly, when they do have the diagnosis from their primary care provider, I particularly am interested in knowing, how is your sugar controlled? How are you controlling your diabetes? And the most important point at this time, we ask people, do you know your hemoglobin A1C?
Hemoglobin A1C is a value that reflects your average sugar levels over time.
So if that hemoglobin A1C is running high, even if you tell me you had a good blood sugar this morning, it means you're not in as good a control as you think. Whereas if you have a hemoglobin A1C of say 6.2 or less, you're doing really well with your sugar control.
The higher your A1C level, the poorer your blood sugar control and the higher your risk of diabetes complications.
I think there's a lot of denial with the diabetes as a disease process in the entire body. Everybody thinks, oh, I've got diabetes, my sugars are up a little. But as what they don't understand is that with diabetes, you're getting a gradual change in the blood vessels of your body that it can affect every organ system.
And that most definitely includes the eyes.
Well, diabetes is a disease that takes your blood vessels from going to be like garden hoses to be like sprinkler hoses. And once those blood vessels start leaking some of the serums and exudates of the body, because we have such tiny blood vessels in the eye, they can leak in the retina of the eye. The retina of the eye is the film of the camera. And there's one particular area of the eye called the macular area, in particular the fovea, which is responsible for your central vision. If it starts leaking into this area, that's where we start seeing your vision going down.
Worse yet, damage may already be done before you experience symptoms. Dr. Smoot showed me what the damage looks like.
A normal fundus, and there you can see the optic nerve, you see a nice white center, which is the cup, and you see the nicely arching vessels, those vessels that arch around, that kind of little darker patch looks like it hugging it. That's what we call the posterior pole, the macula of the eye, which is responsible for the majority of your central vision. You can see now an advanced case of diabetic retinopathy where we have extensive hemorrhages throughout this fundus. And if you look in that area of central vision where those little vessels are hugging it, you don't see that same defined area of pigmented. And that's because there's diffuse, widespread leakage of edema and swelling of those tissues. And this is a minimally seeing eye now because there's been so much damage done.
Dr. Smoot says preventing diabetic retinopathy takes commitment.
They come to talk eyes, and I'm talking about changing your lifestyle. I'm trying to reinforce what your primary care practitioner is telling you every visit. And it's so important to get that reinforcement from different angles. I think the important thing is to know if you control those sugars, you have the opportunity to either arrest the progress or perhaps even improve the progress.
To know for sure, patients with diabetes need to have their eyes checked more often, even if their A1C levels are good.
That's why every diabetic should have a yearly visit. If you have no findings, a yearly visit's fine. If you start having findings, then your eye care provider may say you need to come in sooner, maybe every 9 months, every 6 months, or depending on how advanced the findings are, even every 3 months.
Because, Dr. Smoot says, having your eyes go from this to this is preventable.
To me, when we see these advanced cases, it's very sad and needless because often it's a matter of, the individual not treating this disease with the respect that that disease deserves.
Dr. Smoot says there is a laser treatment that can arrest the progression of diabetic retinopathy. Jimmy has more on what it's like living with diabetes.
Well, one of the places that you want to make sure that your vision is not an issue is behind the wheel of one of these. The speed, the rush, the fun. It's the life any car driver Charlie Kimball is used to, and get this, he is living with diabetes, but that hasn't stopped Charlie from pursuing his dreams. In fact, he's having a banner year with 10 top 10 finishes in 2013. And we are happy to welcome Charlie Kimball with us to Delmarva Life this afternoon. Charlie, thanks so much for joining us.
Oh, you're very welcome, Jimmy. Thanks for having me.
Wow, what a stellar year you are having so far. So tell me, how did you get started?
Well, I grew up watching racing. My dad's an engineer. He designed race cars, and I started go-karting when I was 9, got into cars when I was 16, and then was racing cars in Europe in 2007 when I went into the doctor and came out with a diagnosis of diabetes.
Okay, so it's incredibly fun to watch the race. The camera is mounted on the car. Tell me, what is it like to be there in the cockpit?
Well, it's pretty physical, as you might imagine, trying to hold on to 650 horsepower and racing over 200 miles an hour for up to 500 miles. So I've got to make sure that my body's prepared, just like the mechanics prepare the race car. So as part of my preparation, not only am I dealing with my hydration and my nutrition, but I'm also dealing with my blood sugar. And so I take insulin to make sure that I've prepared my body so when I climb into the cockpit, all I really have to think about is racing and hopefully winning.
Okay, so Charlie, I've got to admit, I'm a little bit envious. You were diagnosed with diabetes almost 6 years ago, and that almost caused you to give up racing. What's that been like?
Well, it was pretty scary. I didn't know if I'd get back in the cockpit, and I remember asking the doctor. He looked me square in the eye and said, "I don't see any reason why not. There are incredible people doing amazing things with diabetes all over the world. You may have to make some adjustments, but it shouldn't slow you down." Well, for me as a racing driver, not slowing down was something I could definitely believe in.
Has the diagnosis changed your life?
I think it's having diabetes has made me a better athlete. As someone said, just getting to the start line is a victory. So if I finish first, like I did in August at Mid-Ohio, or if I don't, the fact I'm out competing is a win for so many people in the diabetes community.
Charlie, what you have gone through is absolutely remarkable. If you were to boil everything down to one message, what would you tell somebody that's going through the same circumstances?
Well, with the right tools and the right management, diabetes doesn't have to stop you chasing your dreams and living your passions. And that's the best point about it, is that you can still go out and do what you want in life.
Charlie Kimball, IndyCar driver, thank you so much for your time this afternoon. I got to catch a ride with him one of these days. Now, whether we have diabetes or not, protecting our eyesight is always important, and it could come down to what you eat. Did you know there are 3 main superfoods? You already know carrots are good for your eyesight, but what other foods could protect our peepers?
You start eating foods like this.
Spinach has a lot of antioxidants that act like sunscreen for the eyes. Eating more of the leafy greens can lower the risk of macular degeneration.
That salmon is perfect.
Eating foods rich in omega-3s like wild salmon helps to protect the blood vessels inside the eye. And gobble up some turkey. Its high levels of the B vitamin niacin specifically guards against cataracts. The zinc in turkey prevents macular degeneration as well. Foods to stop eye disease. Now, for the adventurous eaters, ostrich can also keep your eyes healthy. Leaner than chicken, ostrich packed full of protein, iron, and zinc, which are all needed for great eyesight.